And now we get to hear from Wraparound Milwaukee with Margaret Jefferson, who's the Director of Families United of Milwaukee, and Bruce Camrat, the Director of the Milwaukee County Children's Mental Health Services. Welcome.
Welcome. Thank you. Thank you very much. I'm pleased to be here and be a finalist. I'm going to lead off, and Margaret's going to anchor us. So the point of our innovation in Milwaukee was to create a very unique system of care for children with the most serious emotional, mental health, and behavioral needs who cross at least two or more child-serving systems, child welfare, juvenile justice, mental health, special education, and who are at risk for out-of-home placement, particularly residential treatment, correctional facilities, or psychiatric hospitals. Idea of the magnitude, the Center for Mental Health Service estimates that 5 to 8% of the children in this country are severely emotionally disturbed. There are 200,000 kids 0 to 18 in Milwaukee, so that's 10 to 16,000 children. So it's not a small issue for our communities. What we're trying to do in Milwaukee, which is very unique, and it's sort of an innovations within an innovation, is first of all change the philosophy from going from a very diagnostically driven mental health model to a model that looks at kids' strengths and family strengths, builds on those strengths, individualizes care. We do not believe that one size fits all when it comes to our children. So we want to create very unique and separate plans and services for our children. And we believe that parents like Margaret are the experts on what's best and what their children need. So families drive the treatment teams, not the expert model, because we feel they are the experts. From a perspective of a systems perspective, rather than having 4 separate systems, for instance, child welfare, juvenile justice, mental health, special education, all developing separate plans and services, we integrate all of the planning into one system. One family, one plan, one case manager. Makes it much simpler for families. 2, once we did that, we said, well, let's take those funding silos and let's tear down those silos because they get in the way of serving children and families. So we went to an integrated funding, bring all and pool all of the dollars together to create a very flexible funding pool where money follows the needs of the children and the families, not the needs of the system. So it's a very unique way of looking at it. We also did it as a healthcare model and created this country's first publicly operated public benefits corporation run by Milwaukee County, very unique, that ensures these children, not only for their mental health and substance abuse, but all their social service needs. We are the single payer for all of their needs within that system for those 900 children and families. We also expanded the benefit pool so that rather than having a few services like day treatment, residential treatment, outpatient therapy, we have 70 different services. So you can have mentors, tutors, after-school programs, job coaches, whatever it is. If it doesn't exist, we will create it. What are the outcomes we're seeing for families, for the children with serious emotional needs and their families? We're seeing residential dropped from 375 placements a day to 80 placements, the average daily number of kids in placement. Hospital days fell from 5,000 days to 200 days of inpatient psychiatric care. I closed my own hospital, so which can be done. The clinical scores using the CAFIS and the Child Behavioral Checklist, we see about a 20-point improvement on those. That's clinically significant. We've seen a reduction in recidivism rates of juvenile offenders. We serve a lot of juvenile offenders in Wraparound Milwaukee. We've seen 87% of our kids now achieve a permanent home upon their return. They're returning back to their homes, and we're seeing improved school attendance. So from that standpoint, the outcomes for this program have been very, very positive, and we think it's very replicable. But if it doesn't serve the needs of families, then we're not meeting the most important thing. So Margaret, from a family perspective?
Thank you, Bruce, so much. Thank you for having us here today. Really appreciate that. You heard Bruce talk about the components and becoming innovative. The goal of innovation means positive change for someone, and that someone is the families that we serve. And something is Wraparound Milwaukee. Wraparound Milwaukee is a process. We learn from families. We put families at the forefront. It's not about providing advocacy for families, but it's about being innovative and giving the families the tools they need in an effort to become empowered to do for their family when the system of care is gone. the system of care is there for a short while. Where do the families go after that? Where do the families go if they just need someone to talk to? Well, that is part of our program to make sure that they do have an extended family. A lot of families that have kids with a variety of needs, which I like to say, sometimes don't have friends. They don't have the support. The system of care provides services for families. But what about the times when the families are just feeling down or don't have the means of transport to get to these places where they need to go? Family advocacy organizations help families to meet and fulfill those needs that the system of care does not. It is very important that families have access. And what I mean about access is that youth and parents need access to identified services that are specifically tailored to their needs, services which are culturally competent. And the people that are providing these services surely should be culturally competent as well. Families always should have a voice. What I mean by that, let parents tell you what their total needs are. It's not about us going into the homes and telling the families that this is what I think you need. You're not going to be with that family 24/7 like the parents are. Ownership, which is very important. Let youth and families and parents tell you what their total needs are. Let them own the plan. Let them have a voice. And let them put the plan in place for them. Always remember, each family is unique and have different needs. You must listen to hear what the families are trying to say to you. You hear so many agencies that say we have a vision, we have a mission, but I want to know, what are you doing to keep that vision and mission alive? Okay, we can all talk, but I want to know, how does your vision and mission impact the families you serve? And we hold the bar high at Wraparound Milwaukee. We don't let you get away with much, and that's including us, the family-run organization. We all need to be held accountable. And all the people that provide services in the system of care need to be held accountable as well. It is very important that we listen to hear and not be selective listeners when we're working with youth and families. So many times we'll come into some of the homes and we've got our paper and pencil and we're writing and not looking around. You know, we have tunnel vision, you know, straightforward. What about you're walking in with a position instead of coming in with to help the families? And a lot of time, what we do, we need to ask the family and be polite if we can write things about them and let them know that whatever you're writing, when you're done, they'll be able to see what you're writing. It's about respect, and it's about being culturally competent. And I feel cultural competency is something that we all learn. We can say that we're culturally competent, but it's a lifelong learning experience. And at Wraparound, we hold the bar high, and respect is the #1 key in serving the families.
Thank you so much. It's incredible what you've done. Go ahead, David.
Thank you. I want to applaud you on what you've done. I've never seen anything quite like it. In looking at the outcome data, one of the things you cited was the CAFAS data. You said it had gone up there had been a 20-point improvement. We don't really know what that means. So could you tell us what it is?
Thank you, David.
And over what period of time, and is 20 points a lot? Is 20 points a little? You know, just educate us about this.
The CAFAS, or the Child Adolescent Functional Assessment Scale, is a scale used to, it's actually, a downward score is actually good because it means the level of dysfunctioning. Unfortunately, the scale is not strength-based. It means the level of dysfunctioning is decreasing. So it's done at intake, at the time of at enrollment, 6 months, 12 months, 2 years, 3 years, the disenrollment time. So it basically measures that the family is functioning better. And we use that, and we use the child behavioral checklist, which is another one that the family is the rater of. So we use a lot of, because you want to have different raters. So,
And what's the scale of improvement that you've experienced?
well, we're seeing about 15 points, which, when you try to say what a scale indicates, a lot of times what it means is they're starting in the clinical range, which means that they have a mental health issue. They're clinical, what they call clinical range of functioning, and they're going to a more normal range of functioning.
1 to 100?
The scale, the CAFAS is, the 5-scale CAFAS, which we use, is about 80 points. I'm trying to remember. There's different scales. You can use 7 scales and 5 scales, and we only use 5 scales. The important thing is that it's improving by going down. It's showing clinical improvement.
Yes, ma'am.
When you started by discussing sort of 6 to 7% of children with serious emotional disturbances, and so you estimated Milwaukee has somewhere between 10 to 16,000, just roughly, and you're servicing less than 1,000.
Mm-hmm.
So, how does?
And we're the largest, probably the largest system of care in the country right now, run by a county. We have many more kids, and that's the point. There are many kids out there that still need to be served. We serve 1,200 annually. So what we need to do, and what we're doing, is trying to expand it so that we can serve more and more children. And those kids that maybe haven't risen exactly to the level of child welfare and juvenile justice. So they're there. It's just an underserved population that people don't realize that exists.
Is it fair to say that you're serving the high-end kids, so you're serving the kids who've hit the juvenile justice or child welfare system, and the ones who haven't yet been identified by those systems or done something to bring themselves to the attention of those systems are less served?
Right. We've started with the kids that were the most serious, that probably were in all 4 systems simultaneously. And we've been able to take and increase our number, and now we're going into the schools to begin taking kids that have not yet been identified, in terms of child welfare and juvenile justice. So what we're taking basically is using the saved dollars because we can serve those children and families at less cost than institutional. It costs $9,000 a month to send a child to a residential treatment center. It costs $3,800 a month for a child in wraparound. We can reinvest the savings to serve more children.
Carl.
How difficult was it to get the Medicaid waiver necessary to run this program? And do you think that would be easily obtainable by other jurisdictions that wanted to replicate this?
Well, it took us maybe about 6 months. We had very good support from Medicaid because we created a win-win scenario. They were looking at actually reducing the number of children that were going into psychiatric hospitals. So we use a 1915A. Most people don't know it's out there. It's a voluntary managed care plan. It exists within the Social Security Act. Everybody is familiar with the 1915B, which a lot of managed care, but very few have used the voluntary route. They don't know it exists out there. So, part of it is showing systems how to do it. Some of it is waivers, but a lot of it is political will. That's the key. If you want to do it, you can figure out how to do it.
Follow-up on that? To the political will, you said that you brought the funding stream sort of together, right?
Yeah.
How hard was it to overcome the bureaucratic turfdom and concern over jobs and security in that effort?
Well, it takes some doing. Somebody told me that collaboration could be called an unnatural act between non-consenting partners. So you really have to kind of work from that. I think you have to create win-win scenarios for everyone. They have to see that they can save dollars and get better outcomes for children. And that's how we approached it. We also did a pilot to demonstrate that it could work. So I remember a head of child welfare said, Bruce, I really like you, but I don't like you $8 million worth yet. Can you demonstrate that this approach will work? So eventually we got the $8 million and more from child welfare. So, I think that's what you have to do. You have to create those kind of win-win scenarios.
Well, thank you. It sounds like you are winning. It sounds like you've really pulled things together in a very innovative way and helped kids and helped a lot of kids. So congratulations. It's really,
Thank
really
you.
impressive.